Hospital systems, including Beaumont, Henry Ford, and Michigan Medicine tonight are pleading with Michiganders to mask up, social distance, and avoid indoor gatherings.
And while there is considerable concern tonight about hospital capacity, mostly filled, they're looking down the road 2 weeks ahead, and that is what has them so deeply concerned. Rod Maloney live tonight in Royal Oak with more on the story. Rod.
Devin, you know that in economics they call it a lagging indicator, right? It takes a couple of weeks for us to get to the reality of what's happening on the ground today when it comes to COVID. And that's what they're worried about here. They say they've got enough rooms, they can make enough hospital beds, they can even put up tents if they have to. The one thing that they need more than anything is something they don't have a lot of, and that is staff. The Beaumont and Henry Ford hospital systems say that they're above 90% capacity and don't have much room to expand, even though COVID cases do daily. Still, Beaumont's chief nursing officer, Susan Grant, said today,
our doctors, respiratory therapists, our teams, they're tired and they're worn. And they're not only physically tired and worn, they're emotionally tired and worn.
We are feeling a great pressure point.
Henry Ford Chief Operating Officer Bob Riney agreeing that the staffing shortage is the biggest worry on the horizon as hospitals reach COVID patient capacity.
We evaluate that every day based on staffing and based on bed availability. And I think that the staffing problem is a greater challenge than bed availability.
So what are the hospitals doing to prepare? Beaumont's infectious disease director, Dr. Nick Gilpin, says
some of our hospitals have gone back to establishing a curbside triage center for some of the intake of these patients as they come to our emergency centers.
Now, Dr. Gilpin said there's already one up at the Beaumont Grosse Pointe Hospital, but Sky 4 took to the skies today to see if we could see any of those tents, and there didn't appear to be any. Beaumont is also saying that they're looking into this at Beaumont, Farmington Hills, and Dearborn, but so far, no tents were visible there either. Now, one of the things that they're telling us is that the nurses, particularly nurses who are getting to retirement age, are just exhausted and opting to retire and aren't staying. And so now they're having to go to staffing companies and the like to see if they can get more hands on deck as a way to cope with this staffing problem. Back to you.
So what are the other things then, Rod, that the hospitals are doing here? As we mentioned, they fear the worst is still ahead.
Right, and so one of the things, Devin, that they're looking to do is to be as flexible as they can. They're putting these tents out, but they're also looking back to what happened a year ago, knowing that, for instance, the patients don't stay as long, so they think that they get a little bit of a break there, that the average age of a patient now is about 50, which means that they don't have as many complications, and so therefore they can move them in and out more quickly. Yeah. But they're having to do things like take people who don't normally work in clinical settings and putting them in those if they can in fact qualify, because they need the hands.
Well, a really rough situation at the moment. All right, Rod.